David, could you please? Thank you. Good morning, everyone. My name is Pauli Sturis, and I'm the Social and Human Sciences Program Specialist at the UNESCO Cluster Office for the Caribbean. We would like to welcome you all to our second UNESCO Talk, where today we will be having a conversation focused on shaping an inclusive and equitable recovery from COVID-19 in the region. To start off our UNESCO Talk, we would like to first give the floor to Isabel Vieira, Officer in charge of the UNESCO Cluster Office for the Caribbean, for opening remarks. Our director, Dr. Sally Sanchez, apologizes for not being able to join us today as she had an urgent family matter to attend to. Isabel, the floor is yours.
Thank you, Paula. Good morning, distinguished experts and contributing authors of UNESCO Knowledge Series, Secretary Generals of the Caribbean National Commissions for UNESCO, dear UNESCO colleagues, dear guests. In the Caribbean, while the number of COVID-19 cases has not been as high as in other parts of the world, the social and economic impact of the pandemic has been most significant. The COVID-19 pandemic has led to unprecedented disruptive effects on the lives of the Caribbean people. Data reveals that the COVID-19 pandemic could result in the worst economic contraction in the history of Latin America and the Caribbean, characterized by an increase in unemployment as well as poverty rates. Already, household incomes and the ability to meet basic needs have been significantly impacted. Furthermore, people in situations of vulnerability and communities that were already challenged by economic hardship and social disparities, including persons with disabilities, female-headed households, and youth, have been disproportionately affected by the impact of the COVID-19. A coordinated response mandates multi-stakeholder coalitions that have sufficient evidence available to make sense of the complex new reality for people and take appropriate actions. The medical science have been at the center of efforts to contain the COVID-19 pandemic, providing insights of the transmission of the virus and leading to the development of a COVID-19 vaccine in record time. Notwithstanding the role of social scientists and humanists in preventing and responding to socioeconomic effects of the pandemic should be not overlooked. The social and human sciences offer a unique perspective to understanding the complexity of human behavior, institutions, and public policies, both during the COVID-19 pandemic and now, when planning for the next normal. Strengthening social science capacities at national and regional levels is a building block for an inclusive and comprehensive COVID-19 response. The questions raised by the COVID-19 pandemic and the path to follow in the search of innovative answers have been also revived global awareness on the value of multilateralism. There is an emergent certainty about the importance of a collaborative and inclusive response based on the vitality of a global cooperation system, on societies open to diversity, the free circulation of an exchange of ideas and knowledge, all grounded on human rights. In other words, a value-based and human-centered global community. We do not know how long the pandemic will last, and we do not fully understand all the effects it will have on our societies. What we certainly know is that global solidarity, international cooperation, and knowledge exchange are fundamental to transform the crisis into an opportunity. As the leading UN agency for social sciences, UNESCO works to equip Caribbean small island developing states with the capacities, tools, and resources to produce and make meaningful use of policy relevant and human rights-based social and human scientific research and knowledge to promote inclusive and peaceful societies. In response to the pandemic, we place the focus of our work on understanding and mitigating its social effects, while amplifying the voice of population groups that are traditionally left behind in knowledge creation. To shine light on the realities of the people in the Caribbean, we had the pleasure of inviting 11 experts from academia and social society from across the region to contribute with think pieces for UNESCO's knowledge series on inclusive COVID-19 recovery in the Caribbean small island developing states. We are happy to share that this will also be a Caribbean contribution to UNESCO's Global Inclusive Policy Lab, a platform that enables knowledge co-creation and translation into inclusive policies. The knowledge series takes us, for example, from assessing an effective health response to insights on how the pandemic has exacerbated gender inequalities, to the importance of meaningfully engaging youth in the COVID-19 response. What all these thought-provoking reflections share is the aim to contribute to the global discussion on inequality with new perspective, while highlighting ethical concerns and underscoring specific potential and challenges for people in small island Caribbean countries. On the occasion of the launch of the Knowledge Series, which we invite you to read and share widely, we are honored to count with the presence of 4 think piece authors who will have an informal conversation to share policy recommendations for equitable, inclusive, and human-centered COVID-19 recovery, tailored to the Caribbean countries. We sincerely thank you and the other contributors for your valuable analysis and reflections, and are looking forward to an interactive discussion. The floor is yours. Thank you.
Thank you very much, Isabel. As Isabel mentioned, we take this opportunity to launch a new publication. It's UNESCO's Knowledge Series on Inclusive COVID-19 Recovery in Caribbean Small Island Developing States, which brings together the voices of 11 experts from across the region to shed light on how COVID-19 has impacted the Caribbean. In 2020, Latin America and the Caribbean faced an economic contraction of 7%, far exceeding the global slowdown of 3.3%. The recovery outlook now in 2021 is still very uncertain and heterogeneous, having on one side the rollout of the vaccination process and on the other, the resurgence of the virus in many countries. According to the IMF, Caribbean countries that are mostly dependent on tourism will recover last, for example, in comparison to Latin America, notably because of the slow resumption of tourism. In this regard, as previously mentioned by Isabel, though cases in the Caribbean have not been as high as in other regions, the pandemic has significantly disrupted socioeconomic sectors and livelihoods in the Caribbean region, thus leading to the deepening of existing inequalities. Zooming in, the recovery will also be different within countries due to the differentiated impact of COVID-19 on certain population groups. Furthermore, the pandemic will also have long-lasting impact on human development gains linked to income loss, reduced social safety nets, school and university closures, and increased poverty rates. In the framework of UNESCO's work to amplify the voices of the Caribbean, a key priority for the organization, the purpose of today's event is to discuss some of the policy recommendations and considerations that stem from the Knowledge Series to shape a more inclusive and human-centered recovery process for the Caribbean, with the effort of leaving no one behind. Before we begin, I will introduce our guests. We are joined today by 4 authors of think pieces that you can find in the Knowledge Series. We're happy to be with Senator Dr. Floyd Morris, CARICOM Special Rapporteur on Disabilities and member of the United Nations Committee on the Rights of Persons with Disabilities, Dr. Clive Landis, Chairperson of the Regional COVID-19 Task Force of the University of the West Indies, Dr. Deborah McPhee, Outreach and Research Officer at the Institute for Gender and Development Studies at the University of the West Indies, Trinidad and Tobago, and Ms. Shanice Webb, youth activist and the immediate past president of the Trinidad Youth Council. The format of today's event will be held in a conversational style with a possibility for the audience to ask questions. Please note that we also count on the participation of other think piece authors who are in the audience. So please feel free to write your questions in the chat box, make it visible to both panelists and attendees, and this way we will also be able to share them with all authors to have a more dynamic conversation. In the chat box, we will also be sharing more details on the biographies of our guests and information on further resources that you can read and for further information. So thank you all so much for joining us for today's UNESCO Talk. I would first like to start with a question for Dr. Landis, who in his think piece helps provide a regional snapshot of the situation of COVID-19 in the Caribbean region. So Dr. Landis, in your capacity as chair of the Regional COVID-19 Task Force at the University of the West Indies, can you briefly outline how Caribbean small island developing states have been affected by the pandemic and the related measures?
Yes, certainly. So thank you very much, Paula, and to UNESCO for this invitation. I'm so pleased that you have put together this knowledge piece for the Caribbean. So the Caribbean pandemic, I describe it as the bipolar pandemic, because on the one hand, we have done well. If you take the medical measure of cases and deaths per capita. So if you compare the Caribbean with North America and with South America, we have about, and this is a true comparison because it's per capita, so you can compare small countries with big countries and whole continents. We have about 1/10 of the deaths per capita from COVID-19 as to the north and to the south. So on that measure, we have done quite well. And I think we've harnessed certain natural benefits that we would have in the Caribbean. For example, it's much easier to maintain your borders closed. And research that we published showed that, you know, we were on average about a month quicker to restrict movements and to have border closures and things like that, even compared to other countries in the world that actually did quite a good job. So we were able to contain the epidemic by and large for the whole of 2020. And then gradually, you know, we got into a bit of a patchwork pandemic. But even in those countries where there have been quite significant outbreaks, like Haiti, like Jamaica, like Trinidad, still the level is much, much lower than has been seen in other countries. And also the source markets, tourist countries like the UK and the European Union, etc. So in that narrow sense, you know, we've done well, but it has been so devastating in the indirect impacts that it's had. So Isabel had already mentioned, you know, that our tourism sector has just been decimated. And so that's led to a lot of loss of jobs and pushing people into poverty. Poverty is estimated to have doubled in the Caribbean. And, you know, I don't think I really should go into all of the details which your other viewers, specialists are going to cover, but it's really very broad, you know, with impacting particularly the youth and, you know, women who research from ECLAC and UNICEF, you know, showed that they have suffered more in terms of loss of jobs and potential abuse, and young men, you know, who already were vulnerable in not being well engaged in the school system, you know, that they have become more detached from schools and are at more risk and are losing contact with activities that are good for mental health, things like sports and culture. So the impact has been extremely broad. and very, very dramatic. Although, thank God, the actual deaths from COVID-19 in the Caribbean has been low. So that would be my quick answer to the situation in the Caribbean.
Thank you very much, Dr. Landis, for this overview and for highlighting how the Caribbean has done a good job in containing the pandemic, but again, the socioeconomic effects are quite large and significant. And so in this same line, my next question is for Dr. McPhee. Dr. McPhee, the COVID-19 pandemic has revealed the importance of women, both on the front line, but also at home, juggling multiple duties of care. Based on your expertise, can you briefly outline the impacts of the COVID-19 pandemic on women in the Caribbean? Are there groups of women who are particularly vulnerable, especially now, 1 year later after the onset of the pandemic? You are muted, Dr. McPhee. Great.
Thank you. Thank you, Paula and UNESCO, for compiling the knowledge series, and thank you. I'm saying good morning to my fellow panelists. Your question, I keep saying with regards to COVID-19, it really amplified those gender inequalities, those cracks in our systems, the ways in which access and to resources and livelihoods are shaped by our social and sociocultural realities. I think we know that COVID-19 has really shined the light on these very pressing issues that we have. But I'll just pull out a few in which women have really been recognized as bearing a significant burden with regards to this COVID-19. I'll start with the shifting of healthcare to the household for those persons who are non-COVID patients. We went through a phase where you were shortening the time spent in the hospitals to reduce exposure to COVID-19. And anytime you begin shifting from the health systems and services to the household, there's an additional burden being carried by women with regards to that triple burden. So that becomes amplified. There's also the shifting of school to home. That brought with it its own issues of balancing home and work, because you're actually also bringing work into home. So there's this way in which I say that COVID-19 has almost compressed those separations that used to exist to allow us to, in some way in our head, model our lives. And there's always the issue of the ways in which it has eliminated safe spaces for persons who are victims and survivors of domestic violence, child sexual abuse. All of these are gendered concerns, men and women experiencing them differently, but it is really something about the way in which COVID-19 has really brought this mirror up for us to really reflect deeply on these challenges that exist. You know, persistent reality throughout our region in terms of levels of unemployment among women are always higher than that of men. So we are also grappling with, as Professor Landis said, we're grappling with regional tourism, we're grappling with the service industries, we're looking at these segments of the labor market that are largely occupied by women and lower income men that really make up our service industry. And these are the things that we really need to reflect on. I am also very much concerned about the ways in which COVID-19 has impacted our informal sector. The domestic workers, our sex workers. I shouldn't say informal. On my notes, I had the informal and the illicit, and sometimes illicit, because we are also looking at these sex workers, some micro enterprise operators what we're really looking at is, for me, the ways in which, and that's just the economics of it. I haven't gotten into the mental health of it. Yes, we haven't gotten into the sociocultural long-term impacts that we're dealing with. But what I find in terms of the economics of our existence, what I find deeply troubling is the way in which COVID-19 has really brought to our mind the ways in which those persons who generally do not contribute to our national insurance systems, our national insurance schemes, our questions really will be, how will we manage these vulnerabilities long term? So I'm really reflecting on social protection and the multiple ways in which social protection can exist in a region like ours, and the ways in which we can in some way pull the woman and many times lower income men into our systems of social protection, so that when something like a pandemic happens, they become visible to us, because they remain invisible. And that's what the gender analysis allows, is supposed to be committed to doing, making the invisible visible, but they remain invisible to us because many times they do not qualify for the social protection being offered. And these are things that we really need to reflect on for me in terms of women and pulling them in. So I'll stop here.
Thank you, Dr. McPhee, for highlighting how the pandemic has really exposed significant structural inequalities in the region, and also its disproportionate effect on women, but as you highlighted, on other population groups that often are not, do not have access to safety nets or social protection, and how important that is as well. In order to delve deeper on the impact of COVID-19 on different population groups, my next question is for Dr. Morris. Senator, there are more than 1 million people in the Caribbean living with some form of disability. Can you please share with us how COVID-19 has affected specifically this population?
Thank you very much, and commendations to UNESCO for launching this think piece and having this discussion on what I regard as a very important subject matter, because oftentimes when we have these discussions, persons with disabilities are not included and considered in the discussion. And so UNESCO ought to be commended for your inclusive approach in terms of development. The COVID pandemic has exposed what I call the deep underbelly of the Caribbean society, because we know from pre-COVID times that persons with disabilities were marginalized and isolated from mainstream society, and their marginality in the Caribbean society comes about because of low-level health outcomes, low attendance in the education system, low levels of employment amongst the population, and the negative attitudes that exist within society towards persons with disabilities. So by the time COVID pandemic came upon our shores, it was bound to have a deleterious effect on populations such as persons with disabilities, because of how the society treat and relate to these individuals. So what we saw and what we have seen is a situation where, in terms of healthcare and health facilities, they are inaccessible to persons with disabilities, and the health professionals are not trained as to how to relate to persons with disabilities, because the entire health infrastructure health architecture within the Caribbean has been predicated on what I call the medical model of disability, which says, look, let us treat and care for the disease impacting on persons with disabilities. And if we care for and get rid of that disease, then we'll be able to solve the problems of persons with disabilities. And that sort of ableist rhetoric has not brought any benefit to persons with disabilities. And all of that has been exposed in this COVID pandemic, because the issues affecting persons with disabilities are much broader than the disease that contributes to the impairment of the individual. And then when we look at the whole education landscape, we see again where persons with disabilities are being left behind, because the mainstream education system is not inclusive of persons with disabilities. They don't have accessible facilities to accommodate persons with disabilities. The teachers are not trained by and large on how to relate with persons with disabilities, and the technological support is not there to accommodate persons with disabilities. And as I speak about the technological support, there are significant gaps now in the education system for persons with disabilities, because modern technology is not cheap for persons with disabilities. And in these COVID times, it requires technological support to drive the education of individuals. So you can imagine how devastating it is for persons with disabilities who are unable to purchase laptops, tablets, or any other device that is required to assist with the education of persons with disabilities. And so that is a situation that we have to pay some serious attention to in the post-COVID environment, where persons with disabilities, to make sure that they have access to the requisite technology. And then the whole situation of employment for persons with disabilities. Data, certainly from an ECLAC report, 2017 report, was showing that about 80% of the population of persons with disabilities in the region are unemployed. And we did a socioeconomic study in Jamaica in 2015, which the report showed that about 90% of the population were purely, in terms of the respondents, purely persons with disabilities were unemployed. So it is an indisputable fact that persons with disabilities are unemployed in large numbers throughout the region. And this have an impact on their ability to respond to their various needs and the support that they need in society. One of the things, good things coming out of the COVID pandemic is the whole issue of remote work, which we see where a lot of individuals have been working from home, using the technology to link into their workplaces. Previously, when persons with disabilities were advocating for work from home because of the inaccessible nature of workplaces, the argument used to be posited that, you know, it cannot be done. You have to be here at work to be physically participating. And the COVID pandemic has made that into a big lie. And we are saying that in the post-COVID environment, we have to make sure that we look at the possibility of remote work in the context of persons with disabilities. I just got an article freshly published in one of the leading disability studies journal in the world, Disability and Society, on the issue of remote work and the employment of persons with disabilities in the post-COVID era in developing countries. And I looked at the whole issue of remote work and how we can use that as a means, as a conduit for stimulating employment amongst the population of persons with disabilities. And I think that if we can look at these areas and look at these issues, we will be able to recover stronger and better, you know, and the recovery in the post-COVID environment has to be an inclusive one, because we will not be able to meaningfully and accurately measure development within the region if we have 15% of our population being isolated and excluded from the development trajectory. And I will leave it for now and get back shortly. Thank you.
Thank you so much, Dr. Morris. We've actually shared in the chat your new article as well, if people would like to read it. And thank you as well for sharing this thorough analysis, especially in relation to the significant impact on access to healthcare, education, and employment, but also highlighting how remote work can be a means for stimulating employment for persons with disabilities. And next, we will focus on another population group that has been significantly impacted by COVID-19, and we're talking about young people. Surveys have shown how COVID-19 has impacted youth, both physical well-being, but also mental health, with many young people having a pessimistic outlook on their future due to diminished lack of opportunities. So at the same time, however, young people have been at the forefront of the pandemic, leading community-based initiatives, leading community-based efforts to help their communities and their peers. So I would like to ask my next question to our guest, Shanice Webb. Shanice, in the Caribbean community, there's around 63% of the population is actually under the age of 30. So there's a very large youth population. Can you share with us 2 or 3 examples of how COVID-19 has specifically impacted youth and young people in your country, for example?
Thank you. Good morning to everyone. I'd just like to say thank you to UNESCO for allowing us, myself and Latoya Roberts, my co-writer, to be able to be a part of this knowledge series. I think it's very important that young people's voices are amplified, and really appreciate this platform. When we look at COVID-19 and its impact on young people have been impacted in a myriad of ways, but 3 of the most prominent areas has been in mental health, education, and employment. As it pertains to employment, young people are experiencing high level of job and income loss because they hold low paid and temporary employment in sectors most severely impacted by the crisis. This includes the restaurant and retail industry, as well as the gig economy. And this loss in income and loss in job has a significant impact on young people because young people are more likely to fall into poverty as they have fewer savings to fall back on compared to their older counterparts. In addition, as illustrated by previous economic shocks, young people graduating in a time of crisis really do face a lot more difficulties in terms of finding decent jobs and income, which is likely to delay their path to financial independence. And as much as employment, mental health, and education seem to be separate issues, they're very interconnected in many different ways. So despite the flexibility and commitment shown by schools and teachers to secure educational continuity during school closures, not all students have been able to consistently access education. The Organization for Economic Cooperation and Development estimates show that a loss of school year can be considered equivalent to a loss of between 7 to 10% of lifetime income. And for young people, that is, a significant issue. In the context of school closures, the quality of home learning environment becomes even more important. The digital divide in connectivity and access to electronic devices risk further amplified inequalities among young people during the pandemic. For instance, students from less well-off families are less likely to have access to digital learning resources and parental support for home learning. The closures of schools affect students' mental well-being, as well as teachers and classmates can provide social and emotional support. Educational professionals also play an important role in helping detect and protect against abuse against children. In addition, the postponement or cancellation of exams exposes youth and children to uncertainty, anxiety, and stress. One of the things when it comes to mental health is that with the closure of, so many businesses and schools and all these things, access to mental health services is also a major issue for young people being able to easily access these things. A lot of times, universities like UWI offer mental health services where persons can walk into a clinic and things like that. And when schools close, some of these the way that they access is a bit different. They may have to go online and all those things. So access to mental health services is a major issue for young people. Thank you.
Muted. Thank you very much, Shanice. I think you did a really good job at kind of providing that overview of how young people have been impacted linked to precarious employment, but also highlighting the importance of mental health. And as well access to education and the digital divides that exist, not for young people. I think that was very important to highlight. I will now, in order to make this a little bit more dynamic, we will now open the floor to questions from the audience. Please note that we have also other authors of think pieces that are with us participating in the audience. So if there's topics that, other questions that you'd like to ask, please feel free. We are opening right now the floor to see if there's any questions for our panelists. We can take 1 or 2 questions and then we'll go back to kind of the pre-designed questions. Are there any questions for the audience or for our panelists from the audience? Or I don't see any questions. Good. So there aren't any questions. In the Q&A box. Okay, hold on. There's the Q&A box. Oh, okay. So we have one question from the Q&A box. There's a question linked to, okay, so I'm going to read it. It says, the pandemic has led to diverse secondary effects in the region. What is the importance of ethical principles or ethical considerations when when making recovery decisions? So I think this is really interesting, talking about the ethical kind of lens, ethical point of view. We actually have one other think piece author, Dr. Perkins, who is who works as a quality assurance unit at the University of West Indies, who actually wrote a think piece on ethics and ethical principles. So perhaps I can give the floor if Dr. Perkins is available to kind of address this question on the importance of ethical principles and considerations in COVID-19 recovery in the region.
Paula, hi, thank you very much. And it's really good to be here. Thanks to UNESCO too for inviting us to participate in this knowledge series. It's a really important one. The issues are just very fundamental, but certainly ethical issues are of key importance when we're treating with matters in the time of a pandemic. The pandemic is forcing us to make decisions. And so we have to ask ourselves questions on the basis on which we're going to make those decisions. And what are the principles that guide what it is that we're called upon to do? So, you think about things like vaccine distribution. How do you go about distributing vaccines? Is it going to be on the basis of power and access? Or do you take account of vulnerability? Do you take account of those who might be in spaces, for example, or essential workers who would have to be treating with members of the public that may themselves be either infected or exposed to infections and so on. So clearly, in a time such as this, you would want to prioritize a principle such as the care for the more vulnerable, and you put those first, or you even think about it on a larger scale beyond the individual citizen, and you look at it in terms of countries and nations and so on, and we do recognize that we function in spaces where wealth can overpower access to goods. And look at what's happening with us in terms of vaccine distribution. Some countries have had the wealth to be able to purchase 10 vaccine shots per person in their country, and then in another space, not one vaccine has been distributed and so on. How do we ensure that the way something as important as a vaccine is distributed globally is done in a fashion that really takes account of the vulnerabilities of various countries and the people in the various countries, and that wealth doesn't overpower the ability to access what should be really a public good, this vaccine that is there to take care of and to treat with a public health crisis, which is what something like COVID is. So of course, when you ask questions about morality and ethics in the context of a pandemic, it's really about asking questions about what kind of world do we want to create? What kind of people do we want to be in that space? And are we the kind of people that function in ways that take account of the most vulnerable? Are we the kind of people do we want to create national and global societies that prioritize those that are in need, that make sure that there are spaces that will open up? And if you listen to Dr. McPhee and Senator Morris and so on, we recognize where our vulnerable groups are. We recognize that economies are not as able to give access to social welfare and so on. What do we do with people who are on the margins or not formally employed, but they, because of a pandemic, are much more vulnerable to and are not able, for example, to employ social distancing, or they can't stay at home because they have to go out because they earn from day to day? What are we going to do with the money that we have to put social protections in place, and should we not prioritize people like that? So certainly ethics does not go out the window. In fact, it's quite key in a time such as our COVID pandemic. Thank you so much, and thanks for that great question.
Thank you so much, Dr. Perkins, as well for your response. It's good to have it. Yes, Dr. Morris.
Yes, I mean, I really was intrigued by Dr. Perkins' response, and I have to say this in light of, I mean, current experiences in Jamaica and also throughout the Caribbean, where the distribution of vaccines for persons with disabilities are concerned. Because when you look at if we have to go by the science and to go by the CDC guidelines, which most countries have been using, persons with disabilities would fall into the priority category of either Tier 1A or Tier 1B based on the CDC guidelines. But when we look at the vaccine distributions throughout the region, persons with disabilities have not been prioritized. And that is a major ethical problem in terms of the distribution of vaccine, because again, we are seeing persons with disabilities, when it comes on to the crunch time, being excluded from the issues in the region. And that is a major issue that we have to confront with as a society. We have to make sure that in everything that we do, we protect the most vulnerable groups within our societies.
Thank you, Dr. Morris. That's also a very good point that you're making together with Dr. Perkins, and the importance of ethical considerations. There's the think piece that Dr. Perkins wrote that is going to be available on the chat, so you can have a look at it as well. I'll take one more question, and then there's a few more in the chat box, so we can leave for the end of the UNESCO talk. But the next question is actually, the first one is going to be on the impact of different population groups that have been highlighted. So would it be possible to share more details on the impact on the LGBTI community, as it is also Pride Month? This is also an interesting question because we're thinking about a different population group. We are lucky enough to also count on the participation of another think piece author, Carla Moore, who's a lecturer at the University of the West Indies. And perhaps Carla, who actually wrote about the impact on LGBTIQ plus community could respond to this question. Carla, the floor is yours.
Sure. Thank you very much. Are you hearing me clearly?
Yes, we do. Thank you.
Okay. So thanks very much for creating this space for me to talk about this. And yeah, so the impact on the community is significant. For instance, JFLAG did some research, and of the people in the research, they found that over 25% of them had been affected by either job loss or some type of financial hardship. Another thing that we find is that a lot of people have had to return to their home spaces, so they can't afford to pay rent, they've lost their jobs, so they have to return to their home spaces. A lot of times those home spaces are either not friendly or flat out violent. There might be people who have left a home space and have perhaps affirmed their gender identity in a particular way, and now after affirming, they have to go home and have to deal with the psychological violence of either going back to performing the gender identity that their family or community is comfortable with, or they might experience violence because they're unwilling to make that change. When we talk to people in Guyana, we talk to people in Jamaica, we talk to people in Belize, people will tell you that, some of the things that they're in need of is like basic supplies, just like food. So some of the organizations have done food packages and have been distributing them. That's one of the ways they've been responding. For persons who, for instance, are especially vulnerable. So when you look at the members of the LGBT community who are also PLHIV, or members of the community who live with comorbidities, they have concerns about, if it is that food is distributed in our communities, will we get access to the food? So let's say the state steps in and decides that they're going to distribute food. Will we get access to food, especially if the food is distributed based on favor? If they don't like you, you're not going to get put to the front of the line. So there's a possibility that we might get left out. Can we afford to purchase masks? Just something as basic as, can we afford to purchase the masks that we need to go out to get access to our medication? So we recognize that we know overall COVID-19 exacerbates and multiplies social inequality. And when you talk about LGBTQIA persons, they're already living with high levels of social inequality, and COVID-19 has definitely made it harder, in particular because for a lot of LGBTQIA persons, home was not a safe space to start with, because they may be living with family members who are phobic in some way. So I know that CVC has done work around trying to get food packages out, trying to get masks out, trying to create kind of like a more direct pathway to get people to their medication, trying to minimize some of the interactions that members of the community might need to have while accessing services that might open them up to violence. I know that other organizations on the ground are doing food packages, but overall, I think that what is required is for us to think intersectionally at all points in time. There's a way that I think sometimes we get very comfortable handling the basics, and we say, oh, we're meeting 40% of the population, or we're meeting 60% of the population, or 70% of the population. But as we've heard here, that 30, that 20, that 10, that 5 that we're not hitting might be the ones who need even more support. And so I think it's really incumbent on us to think intersectionally and to think about equity as opposed to equality, and to be even more intentional in our work as we move forward responding to COVID-19.
Thank you so much, Carla, for really shining light on the impact on this population group, but also as well as highlighting the importance of intersectionality and the idea of really looking beyond the big numbers and really looking at the population groups that are sometimes often left behind. I'm going to take one more question because there's a few in the chat box, and then we're going to move on. But there's an interesting question on debt. And this is going to be for our panelists. So one recovery barrier for Caribbean economies is debt servicing, which can ultimately lead to less social spending. In the Jamaican context, for example, the debt interest rate is around 12%, which is highly constraining. So the questions would be, to what extent is debt servicing an impediment? And what are some recommendations for inclusive recovery taking into consideration this debt constraint? I'm opening the floor for panelists if they have any would like to respond to this. Dr. Clive, Dr. Landis, or Dr. Morris.
Um,
Back, Dr. Mafee, please go ahead.
I think I want to take us back when we started to talk about servicing our debt and the ways in which some on the chat may be a bit young, but we have walked the road of a structurally adjusted Caribbean economies like Jamaica, Trinidad and Tobago. We have felt the gendered fallout from those economic adjustments that are required. And what becomes very critical for us is the fact that one, ultimately, the invisible remains invisible. When we pursue these economic options and do not reflect deeply on the social fallout, and not only just the numbers with regards to social fallout, but with regards to the ways in which different levels of ability, issues of sexuality, issues of race, issues of color, sex, gender, geography is big for us, the way in which our rural communities are set up in terms of their ability to access the resources of our economies. When we do not take time to work through the issues of that social fallout, I am always concerned when we have very clear neoliberal agendas that are premised on economies that are not as committed. The question is about equity, to build on what Carl, I think, just said. And when we begin to have these conversations, I just really want us to have not just conversations of economics, but we need to have conversations of gender. We need to have conversations of socioeconomics. We need to have broader conversations around the ways in which, in the midst of us trying to ensure that our economy survive, it's very important. How do we weigh access for different sections of our populations? So that's just my concern.
No, thank you, Dr. McPhee. Actually, that links to another question I would have for you, because, and now that we're moving on, because in the think piece that you wrote, you reflect on Caribbean public policy realities in relation to gender, and you really shine light on what you're talking about, this kind of intersectional approach. So what do you think is the added value of having an intersectional approach to recovery efforts, to really thinking about having a gender lens, especially at the policy level? Like this is linking to your previous introduction.
So when I hear your question, I think about, is there any other way for us to have good public policy other than an intersectional approach? So that would really be my question. Thinking about this, I had to go back to a most profound call for intersectional public policy making, which was made by Ian Alvarez. He has a song called The Heart of a People, extremely profound. Ian Alvarez, by the way, for the Caribbean folks on the call, is I'm talking about Bunji Garland, who is a soca artist from Trinidad, and he has a song called "The Heart of a People," and I think it's a conversation he's having with the pandemic, and I really urge us to go on YouTube and listen to this song, because he speaks to, it is to me the most profound call. And I'm sorry to say that. I'm not sorry to say that because somebody from the university might say, but no, you can say easy. But it is the most profound call for intersectional public policy making, because he's really asking us to reflect on affect, a carnival effect, where he's saying there's an entire economy connected to affect. There are people who are running the pipe. There are people who are running the lights. They're putting up the tent. There's the police, there's the ambulance. There's a youth man selling ice on her bike. There's the youth man watching your car until sunrise. But there's also the woman selling water, juice, and hot chicken and fries. And he's also talking about the person, when carnival happens, has not been able to happen, who will make enough cake to sell to the children of the diaspora. And that woman will make enough money for the entire year. So there's a way in which he clearly maps the way this economy of effect and the formal and the informal connects to it. So in the midst of a pandemic, when you say there's no carnival, and so what? It is really interesting for me to listen to him, because ultimately he's calling on us to reflect differently in terms of, one, the ways in which differently located sectors of our population connect economically to something as simple as a carnival fete. And he's also making a number of intersections very real for us. Ultimately, he is also challenging the way in which much of our policy making sometimes become hinged on a one-dimensional reading of whatever it is. I'll throw back, I'll put the fete back. A fete is a party. You never think about the economics of the fete. And so for me, when we think about public policy making and you're asking about intersections, we live in the intersections. That's where reality happens. You're not only a singular identity, you're not only raced, you're not only sexed, you are not only colored. Yes, and ultimately your sexuality, your class, all of these ways in which margins are formed, because at the intersections, margins are formed and people become invisible. But I do think in a post-pandemic world, we cannot afford to have that. We cannot afford to grow increasingly comfortable with the ways in which the margins are formed. And we would really have to start to think through policy in a different way, because the economics of our lives have changed, the social reality of our lives have changed. And one of the things that I'm really concerned about is the ways in which we will engage children as they move forward. There will be this large group of children that we have to address the fallout of the pandemic with systematically. Who are they? So in the policy world, we provided tablets, many of them. But what about the intersections of levels of supervision, family forms that determine the quality of education? And all of these issues, we will have to find ways of managing. So we will be managing the future, but there's a way in which we will have to think through what are the conditions? How do we mitigate against the fallout, the negative fallouts of the pandemic becoming endemic to our societies? And that requires us to really think intersectionally in terms of how our different populations will be affected and assisted systematically out of this, the negative fallout of this pandemic. So I don't think we have a choice. The intersections are really, where the margins happen, and we have to sit down and work through those margins. Yeah.
Yes. No, thank you. Thank you so much, Dr. McPhee, for really sharing this importance of an intersectional analysis, that there's no other way than to think about it intersectionally for a more just and equitable recovery. So thank you so much for shining light on that. And I have to find the song as well to listen to it. Continuing with the conversation on inclusive policymaking, my next question is for Dr. Morris. Senator, together with UNESCO, you are actually currently working on preparing an interministerial meeting to advocate for legislation for people with disabilities, which is scheduled to take place this summer. Can you share how the impact of COVID-19 has highlighted the importance of inclusive legislation, and how can we ensure that people with disabilities are really meaningfully included in the COVID-19 recovery efforts?
Well, Paula, I'm very happy that you have raised the issue, because, in building capacity for persons with disabilities in the Caribbean, legislation has to play a fundamental role, because it is legislation that is going to change some of the negative attitude and stigmata relating to persons with disabilities that are so deeply entrenched in Caribbean society. And so the conference that we are having is going to be focusing on a lot of the issues that have been impacting on persons with disabilities, most of which have manifested themselves during the COVID crisis. So, for example, I spoke about the whole issue of healthcare. I spoke about the whole issue of education for persons with disabilities. I spoke about the issue of employment. And these are day-to-day reality issues that affect persons with disabilities during the COVID pandemic. And when we are thinking of formulating legislation, these have to be a part of those legislation that we are formulating. So we have to make sure that healthcare facilities and health professionals are trained by law to relate to persons with disabilities. We have to make sure that our educational institutions are accessible to persons with disabilities, because under the Convention on the Rights of Persons with Disabilities from the United Nations, we are pushing the inclusive education agenda. And we are saying, rather than confining persons with disabilities to special education institutions, bring them in the mainstream educational system so that they would be able to get the normal, regular education that others are receiving. And likewise, we want to make sure that employment is a strong feature of legislation, and that persons with disabilities are not discriminated at the workplace, because it must be some form of discrimination taking place while you have between 80 and 90% of the population of persons with disabilities in the region being excluded from the labor market. And legislation have to correct that. And the experiences of COVID speaks volumes to that. And so the conference, we are going to be preparing as an outcome document, a model legislation that we will be saying to countries that do not have legislation already across the region. We're saying to the government, this is a model, this is a template that you can work with, and we hope that within the next 5 years, we'll see all the countries within the Caribbean establishing specific legislation to protect persons with disabilities. And whilst I complete that answer, I want to respond to my colleague in terms of the argument about intersectionality and the whole issue of the debt across the region. History has shown us that whenever there are challenges, whenever there are problems, persons with disabilities are forced to the back of the line. And in the public discussions and in the formulation of public policy, I mean, because you don't have a lot of persons with disabilities sitting at the table of decision making, oftentimes these individuals are not considered. And more and more, since the concept of intersectionality was introduced by Kimberly Crenshaw 20 or so years ago, I mean, we are seeing that the issue is given more prominence, because as with gender, as with issues of age, as with issues of sexuality, issues of disability are being brought to the fore. And we have to keep on pushing to make sure that when public policies are being formulated, that persons with disabilities are not excluded because they are a critical part of understanding social realities. They are a critical part of the intersecting formulation of society. And one of the things that I will be doing, I will be relentless in my pursuit. And that's why I'm very happy at the opportunities given to me by the University of the West Indies in terms of my research work, in terms of CARICOM and the United Nations and the Committee on the Rights of Persons with Disabilities, because I will be relentless in my pursuit to make sure that the development agenda includes persons with disabilities. So irrespective of high debt, irrespective of low debt, provision must be made for persons with disabilities because they are an integral part of the society. Thank you.
Thank you very much, Dr. Morris, for really highlighting the importance of legislation for upholding and respecting the rights of people with disabilities. We thank you so much for your insights. I have one question now for Shanice. Shanice, last year, the Trinidad and Tobago Youth Councils, together with other youth organizations, developed youth-led recommendations for social and economic COVID-19 recovery. Furthermore, in the think piece that you co-authored with the former president of the Tobago Youth Council, Latoya Roberts, who is with us in the audience today, you call for more meaningful youth engagements. So could you please share recommendations on how young people can get involved now in the recovery efforts, and what can decision makers do to ensure meaningful youth engagements?
Thank you for that question. So in terms of young people being involved in the recovery effort, we saw at the beginning of the pandemic with, speaking to the Trinidad context, with the establishment of the Roadmap to Recovery team, and I know that other similar initiatives were started across the region. We saw civil society and other stakeholders being engaged to really, you know, I guess in a different style of governance, where members of the public and civil society were engaged to be able to make contribution towards the recovery effort. And, you know, we had critiques about the level of involvement of young people at that time. And you know, that was the genesis of our recovery team report and initiative, right? And so I think that critique still exists, where there isn't necessarily a space in which young people could contribute to the recovery effort. But I think that young people could mobilize and form coalitions, not just with youth councils, but with student organizations and unions and other civil society stakeholders to really advocate for those spaces to exist, for the community to be able to really speak to what their issues are, not just for young people, but all marginalized groups to be able to have a say in decision making and to be able to really contribute meaningfully. So it isn't necessarily that we looking externally for something to be created, yes, but we also need young people to take the initiative and also be at the forefront and actually create a mandate in terms of what we actually want and we want to say and how do we want to communicate that. And in terms of decision makers and youth engagement, how can they improve youth engagement? I think that decision makers need to adopt a youth mainstreaming model where young people are a part of the process all the way through. Right, so it isn't necessarily, for example, with the knowledge series, young people are a part of the knowledge series. Young people contributed towards it. It wasn't that it was made for young people by adults or, you know, experts, but young people were a part of the process all the way through. We're a part of the panel discussion. So that's, to me, what a youth mainstreaming model looks like, right? And I think that decision makers also need to be able to adopt that. So youth mainstreaming is based on the guided vision of all social groups benefiting equally from the fruits of development and participating in the development in accordance with their full human potential. Youth mainstreaming can be defined as strategies for intergenerational equity and justice that enables young people's capabilities and participation and human rights to be integral dimension for the analysis, design, implementation, and monitoring evaluation of policies and programs in intersectoral planning across all social, political, and economic spheres. It enables young people and adults to benefit equally from the and contribute equally to the development outcomes. So as much as the engagement itself is important, but the goal is really about social equity for young people and all groups and all minorities. So the engagement itself is not the goal, but the equality is, right? And in order to achieve that, we need promotion of age and gender diversity in public consultation, state institutions to reflect the needs and concerns of the different age cohorts in decision-making. And we also need the alignment of short-term emergency responses with investment in long-term economic, social, and environmental objectives to ensure that the well-being of future generations. Because we know that the decisions that we make today in terms of the COVID-19 response is going to have long-lasting effects on young people and future generations. So we want to always, as much as we want to respond to the pandemic now, and we know that there's like, we need to do a quick and dirty approach in terms of getting the numbers down and making sure that, you know, we have room in the hospitals and all those things, but we also need to not forget the long term, not forget, you know, these are the future of our nation, these young people, you know, what's going to happen to them 5-10 years from now when we look at education and, you know, the challenges that young people faced before in terms of dropout rates and those things that, you know, exacerbated with these other challenges. What does that future look like? And how do we now look into the future and say, okay, how does employment now look? If it is that we have young people, this group of young people for at least 3 years or 4 years, this generation of young people that had educational challenges, are we going to have the same measurement or same standard when we look at employment and job requirements and those things? Like, what are the things that we're looking for and how do we shape those things moving forward? So it's not just about the short-term emergency in terms of COVID, but looking at what are the long-term repercussions of the decisions that we make today. And also we need to have and provide targeted policies and services for the most vulnerable youth populations, including young people not in employment, education, training, young migrants, homeless youths, young women, adolescents, and children facing increased risk of domestic violence, right? Youth mainstreaming is therefore part of a broader strategy for non-discrimination and equality for all. Thank you.
Thank you. Thank you so much, Shanice, for really shedding light on the importance of thinking about long-term impact on youth and also talking about youth in their whole diversity. So it's not like a homogeneous category. And for also bringing to light the role of CSOs and youth coalitions to advance dialogues that will put young people at the table in decision-making. As you mentioned, it's not only important to be included as a beneficiary, but also to be part of the decision and to be able to voice your needs and aspirations. So thank you so much for sharing that. I have a final question for Dr. Landis. And my question is linked to the University of the West Indies is collaborating currently with UNESCO on amplifying the voice of small island developing states for equitable recovery. And actually soon we'll be co-hosting a multi-stakeholder dialogues to link research to policy and practice. Against this backdrop, what is the role, or according to your expertise, what is the role of Caribbean universities as research and knowledge production institutions for contributing to the recovery process and even policymaking?
Yes, well, thank you very much, Paola, for this. I think that we have 3 areas where the universities of the Caribbean would contribute to the inclusive recovery process. One is to provide information. The second is to underpin the recovery with ethics. And the third is to reimagine how we are going to rethink the workplace and socioeconomic recovery. So information, ethics, and reimagination. And in terms of information, we've already been providing accurate information and contextualizing it for the Caribbean with daily surveillance data, which we benchmark against best practice countries like New Zealand and Iceland and Singapore and things like that. And that's for policymakers to make good decisions. However, information also filters down to the personal level. So, for example, when you look at the phase that we're now in with this pandemic, we're now in the vaccination phase. You can already see from the way that fully vaccinated countries or nearly fully vaccinated countries are actually reopening. You can already see the exit strategy and how the pathway should go. However, there is vaccine hesitancy. There's a lot of misinformation, and even worse than that, there's disinformation, which is deliberately intended to harm, which is going around. And so the university has a very critical role in providing accurate information and to actually specifically take on vaccine misinformation. And we've had a number of forums, and they've been very well attended. And we take questions from the public and we try to address their concerns. So that's really the information segment. In terms of ethics, it's already been mentioned that, you know, in this series, the dialogue series that we're going to be hosting in Jamaica, Barbados, and in Trinidad, we are very keen on making sure that ethics underpin the recovery. We can't go back to what existed. There were so many inequalities already. They've just been worsened. And, you know, the groups that we've already spoken about, the vulnerable groups, they're very typically not present when policies are being made. And they will be present in this dialogue, which UNESCO will be hosting with UE, so that we can have an ethical recovery process, that we can have all those voices looking at how the recovery should go. And then it is simply to reimagine. You know, this is what universities do. We create new knowledge and we think about new systems of governance. And Don Marshall, who is one of our collaborators on this, you know, is a really sort of big thinker. And he shakes things up a bit, you know. So do we need to have a 9 to 5? Well, let's get rid of the 9 to 5. If people wish to work from 7 until 3, which happens to fit in better with the school run, why not? And so, you know, that is the job of universities, is to break new boundaries in creating new knowledge. So those are the areas where I think the University of the West Indies will play a very big part. And then increasingly, it will be emphasized away from the medical aspects and more towards the social and socioeconomic aspects of the recovery process.
Great. Thank you so much, Dr. Landis, for sharing these insights. And yeah, we're definitely very happy to be working together to kind of see more how we can amplify voices of those that are usually not heard. And I think this is kind of really interesting collaboration moving forward with the University of the West Indies. We will now just open for another brief round of Q&A before wrapping up. There were some questions that were left from the chat. There was a question that was focused on the impact. Let me open my chat really quickly. Okay, so there's a question is if it's possible to shed light on how Indigenous populations in the Caribbean region can also be meaningfully included in the recovery phase or recovery strategies. I think this is also a very interesting question, and we're happy to share that we have, I believe that Marie-José Artist, who is a community development specialist at the Association of Indigenous Village Leaders at Suriname, is present with us, and she wrote a think piece on the impact of COVID-19 on Indigenous peoples in Suriname. So perhaps, Marie-José, if you would be willing to respond to this question and kind of see how Indigenous people can also be meaningfully included in COVID-19 recovery.
Yes, thank you. Thank you very much for this question. Maybe I can start to refer to my the former speaker, because he was saying something about people who are not present in decision making and in dialogues. And that is the case, especially for indigenous peoples here in Suriname. We are not included in these kind of processes. Although from the beginning of the pandemic, we let our voice heard, but we were never invited. And but we are still trying to be heard. And we have now some agencies, UN agencies, who are including us in processes. And that is one of the important things. For indigenous peoples, things like food security is very important. So especially in the recovery phase, now we need to be, food security is one of the most important things for us. We lost jobs and all these kind of things, what already was mentioned by other populations is also the same with indigenous peoples. But we have also our traditional systems, and in the recovery phase, I think we have to strengthen our traditional systems. We now experience, for instance, that our traditional food systems were not strong enough in the community, so we were not able to overcome the periods when we were in lockdown. We didn't have enough food in our communities. We were depending on outside institutions for us to give some food packages and things like that. So indigenous peoples in communities, they realize they are able to have this their own foods, and that they have their own food systems, etc. So we need to strengthen them again, and for that we can do that with together with others. And this is just one example, but we first need to be heard, and we first need to be in the decision-making processes. Policymakers, they do need to hear us, because then only they can be aware of our knowledge, and then we can be included. Our governance systems also can be adapted, and these can be strengthened as well. I think that's what I can bring in now. Thank you.
Thank you so much, Marie-José, for being with us, for your insights. And you can read Ms. Artis' think piece on our website. The link is on the chat for you to get more insights on the impact of COVID-19 on Indigenous peoples and Indigenous populations. So thank you so much, Marie-José. We would have another question that's actually focused on education. And this has been brought up by different panelists today. So the question is, before COVID-19, there was an enhanced local and global focus, work-based learning and tertiary education. So for example, internships, apprenticeships, work studies as a key strategy to develop graduate employability. So how are we to approach such strategies for employability and inclusively as we reopen both our societies and prepare for any upcoming crisis? If there are any of our panelists that would like to speak to that. No, there's no, is there any way?
Can you repeat the question? Part of it was kind of breaking up for me.
Oh, sorry, yes. So the question is, before COVID, there was an enhanced local and global focus that was focused on work-based learning in tertiary education. So there was a lot of internships, apprenticeships, work studies that are no longer taking place. And this was to develop graduate employability. So do you think there's going to be new strategies for this? How can we focus on employability of youth considering the impact of COVID? Maybe you can answer that, because you as a young person, how do you see the impact on the labor market?
I think that these initiatives, I think, are even more important now, especially with the challenges that young people are facing in terms of education And some persons, you know, as I said before, may drop out of the educational system because they may not have access, or, you know, there is that level of some young people that do on a normal basis or in pre-COVID times would have not reached city level of CXC or to university level, you know, so we need to make accommodations for those young people. And I think it is important that we continue to do so. Being inclusive, I think that, especially I think in Trinidad context, sometimes we may be seen as, in terms of economics, a higher earning country. So sometimes we may not always have access to some of those opportunities. But with the changes in terms of COVID and its impact on the economy, I hope that some of those things change and we do see some of these opportunities coming to the Caribbean region. I know that there's some of the Caribbean people, young professionals that work, they have been working to get internships and stuff like that for young people in the Caribbean, the Pacific and Africa, because other regions have those internships within their different institutions, and those don't exist for us. So those are some of the things that that they are working towards, and I think we all need to unite our voices around these issues. As I said before, we need to form those partnerships and coalitions to strengthen our voices and speak out on the different challenges when it comes to young people and employment, and even these internships and scholarships and those things.
Thank you so much, Shanice. We'll take the final question and then we'll wrap up our conversation today, which was very interesting. And now we've discussed, so we talked a lot about policy making and decision making, but there's a question that is focused on the role of civil society organizations. And Shanice brought this up as well in youth coalitions. But what is the role of CSOs to also advance gender responsive COVID-19 recovery? I don't know, Deborah, if you would like to speak to that. I also know that Ms. Folade is also with us today. I don't want to put her in the spot, but she is another think piece author, and she's the founder and executive director of the Women's Institute for Alternative Development in Trinidad and Tobago. So they've been big activists on the ground on advancing gender awareness and advocacy on COVID-19. So if Ms. Mutota would like to take the floor on highlighting the role of CSOs to advance gender responsive COVID-19 recovery strategies, she is welcome to, but we don't want to put her on the spot. But perhaps also Deborah, maybe you can speak to that as well on the role of CSOs in advancing kind of COVID-19 recovery. Yes, Ms.
Thank you very much for the opportunity, but I'd be happy to follow Deborah, who I suspect would be able to cover this topic quite adequately. But thank you very much for the acknowledgement and the opportunity.
Deborah, I think it's giving the floor to you, Ms. Mutota.
I was happy to give the floor. I was happy to defer to Folade. Yeah. You know, I know Folade is going to speak to this, but in terms of me, all I can really reflect on in terms of civil society and levels of gender responsiveness is the fact that it is very important for us to, as we make policy, not end up in an echo chamber. We tend to speak to consultation after decisions have been made. And I know Shanice also spoke to this. There is also a need for us to reflect on what is ethical consultation, because ethical consultation requires our table of decision-making to be very diverse. And I will pause there, and because that to me also is where civil society comes in. I will pause there and ask Folade to take up this conversation, right? Folade?
Thank you very much, Deborah. Oh dear. Yes, I want to start off by endorsing what Deborah has said. The business about ethical consultation is really an issue that civil society has to drive. There's a demand that we have to make, despite our actions being considered to be unsupportive of the decisions that the state is making in this particular period of time. I think that civil society has to mobilize. We have a duty really to mobilize. Across the region, the state response has been a command and control response. And it is a response that I think that our governments have been allowed to get away with, understandably, because there's a lot of fear among all of us as populations that have to face the consequences, the uncertainty and the threat of a pandemic. But also a fear of being on the wrong side of history. The uncertainty of the pandemic really sort of corral people into a space of fear and uncertainty and inaction. And we have to remember our role, a huge part of which is holding our governments to account, so that there has been insufficient accountability, for example, for the use of resources, the decisions around vaccine accumulation and distribution, etc., etc. And we have been unable, I think, as civil society to mobilize and to take strong positions to hold governments to account, bring them to the table, and not only wait for ourselves to be invited to sit at the government tables, whether it's in recovery teams or task forces or whatever the teams are, but it is important for us to ourselves mobilize ourselves and invite the government to sit at our table. And I think that is the work to be done now as we get more comfortable with the realization that the command and control approach that our governments have used in managing the pandemic and managing the resources of the country have silenced us, and that we have been complicit to some extent in that silencing of ourselves, and that as a result of that, we may not be as ready as we ought to be to embrace a new future that requires much more from us in terms of participation, in terms of the diversity of our teams for decision making, and in terms of public policy. Let me leave it there. Thanks.
Thank you so much, Ms. Butota, for taking the floor. And I'm going to give the final.
Paula, if I may jump in here.
Yes, Dr. Perkins, I was going to give you the final word, and then we're
brilliant.
Wrapping up.
Thank you very much. As I listen to the question about civil society and gender, I think that there's one particular area of civil society that may not be as involved positively in the conversation, and perhaps the indictment that Faladi is making needs to also be taken into account in that particular space. I think we have to call our faith-based organizations to account, or churches or mosques, all the other religious spaces are very important spaces for forming Caribbean character and to help to shape the values that take us forward, the ethical values that will help us to make the kinds of decisions that take account of the vulnerable, that take account of the need for inclusiveness. And the faith-based spaces are oftentimes spaces that are not sufficiently gender sensitive or even gender aware. And they will support, and I say we as part of faith-based space myself, and recognizing that because religion is so central to the way of life of Caribbean people, they can't not be part of the conversation at the table, but at the same time, our engagement ought to be a critical engagement such that, as Fulani is arguing, the interaction ought to be one that brings our state to account, but at the same time, we should hold ourselves to account as well. There is much that the faith-based space has to contribute, even as it should ask itself questions around how it treats with gender in particular, how it treats with matters having to do with people who have differing gender identities from the norm, how we treat with youth, because we function in spaces that are oftentimes religiously authoritarian, and that could even be considered to be ageist. So how do our young people fit into that space? I think too of the earlier part of our conversation around the space of the university. And part of what we do bring is that our larger constituency happens to be the young people. They're the ones that are the leaders of the future. So they ought to have a significant space at the table. And one of the things that is coming particularly clear to us is how much we can learn from what young people are doing, particularly because of where they're involved in our critical, creative, and sports industries, for example, which help to shape what's unique about Caribbean identity. And if you look at how our young people have been pivoting in the space of COVID, we can learn a lot about how we can treat with and remake the entire way that we live, remake the entire way that we function as a globe, so debt. There is debt that can be unethical, so some of that coming back from our earlier conversation. So just thinking that there is so much more that needs to be said and done, and that our religious spaces can be and ought to be activists. So thank you for giving me the opportunity.
Thank you so much, Dr. Perkins, for shedding light on different perspectives. We appreciate your contributions, as well as Dr. Ms. Mutota, who spoke here at the end. I just wanted to thank you all. I think we're going to wrap up now because we've taken up a little bit more time. And today's talk was very insightful. And on behalf of UNESCO, we would like to really thank you all for joining us today. As a takeaway from this conversation, I think it is important that we continue advocating for equitable, inclusive COVID-19 recovery strategies by enhancing knowledge production, by strengthening the voices of those that are most affected, and by supporting policymakers to build on the potentials of the Caribbean. We invite you to read and share the knowledge series. We are sharing the link on the chat. We also invite you to learn more about our work in the region by following UNESCO, the UNESCO Cluster Office for the Caribbean, on our social media. Our handle is @UNESCO_Caribbean. And finally, we would really like to extend our gratitude to our guests today, and as well as thank all the authors of the think pieces who joined the webinar. Thank you so much for your time and for this opportunity. As Judith Weatherburn actually highlighted in her think piece, the end game is not to go back to where we were, but to really move strategically forward to reducing all forms of inequalities. Thank you all very much for tuning in, and we will see you all in the next UNESCO Talk. Thank you.
Thank you. Thank you.
Thank you.
Thank you very much, Paula. Thank you, everyone, and especially those attending.
Thank you all very much, colleagues. This was great. Looking forward to more.
Hi, Anna.
Thank you. Bye.
Hey, Deb.
Nice meeting everyone.
Good to see you.
Thanks. Same here.